For nearly 2 years, we at UF have been challenged in countless ways by the COVID-19 pandemic. And our resilient students and committed faculty and staff have met the moment. I am particularly grateful for everyone at UF Health for working tirelessly to keep us as safe as possible, including members of Screen, Test, and Protect, for giving us the tools to continue to study, to work, and move forward. Our colleagues at UF Health personify our university's core values of excellence, discovery and innovation, inclusion, community, and stewardship. And I am deeply grateful. Please join me now in reflecting on their achievements.
Excellence is not based on a singular act or moment. It's about an unrelenting drive to expand and enhance what we as Gators are called to do. In the 2 years the pandemic has been part of our lives, the University of Florida and UF Health have never stopped improving systems and services to support our community. From the classroom to the residence halls to the hospitals and beyond, we found new ways to explain expectations, bust myths, and promote healthy habits.
We doubled down on cleaning protocols, established quarantine and isolation processes, and built digital platforms as the foundation of our work. Faculty and staff from across the university stepped into new roles, lending their expertise and voices to amplify efforts in the fight against the virus, never losing sight of our purpose as an educational institution and a flagship land-grant university.
As the pandemic evolved, UF scientists pivoted, proposing responses big and small, many from makeshift home labs. They mixed hundreds of gallons of hand sanitizer. They 3D printed thousands of nasal swabs. They designed simple, inexpensive ventilators. Engineers teamed up with virologists to understand how COVID-19 spreads through the air. Biostatisticians were world leaders in modeling when and where to expect the next outbreak.
Tourism and business scholars calculated the pandemic's impact on Florida's economy, while education researchers calculated its impact on students and teachers. And through it all, they continued to pursue other avenues of scientific inquiry, breaking records for new proposals and new funding for research from astronomy to zoology.
We learned how to be truly more inclusive by working closely with leaders in traditionally underserved areas within our city. By forging these new relationships, we created a healthier and more empowered community. We brought testing and vaccines to vulnerable populations, fulfilling our mission of service, and advocated for those who might not have had access to treatments and care.
The pandemic highlighted new areas of opportunity, and we're thankful for the compassionate and empathetic care providers who stepped up and stepped into that role. We're better for it.
When life changed so drastically, our daily routines were upended, giving us all an opportunity to reach beyond our normal boundaries. We learned to better understand how we all connect to support each other. Students, staff, faculty, neighbors, businesses, healthcare teams, farm workers.
All played a part, from organizing food drives to standing up testing centers, to teaching online, to staffing vaccine clinics. We pushed the greater good on campus, throughout Gainesville, and across the state by sharing what we knew each step of the way.
Whether it meant students volunteering in droves to inoculate the public, medical leaders persuading the reluctant to choose vaccination, or intensive care unit doctors, nurses, and staff stepping into the void to care for patients felled by a disease the likes of which they never have seen, the UF Health team took a leadership role in working to manage the COVID-19 pandemic.
While the virus has been, and continues to be, the most serious test UF Health has faced, we've led the way in helping the community and our great university adapt to the ongoing challenge.
Thank you again to our healthcare heroes. Thank you for demonstrating to all of us our university's core values.